Hey there, I wanted to do a quick update on my surgery recovery. Today is the 2-week mark since I had my L4, L5 microdiscectomy. And I watched a lot of videos before I had this surgery, and everybody seemed, there were some day 1, day 2, day 3 recovery videos. That was not going to happen with me. So I'll tell you what it was like for me, because I wasn't making you a video on the day I got home. So a microdiscectomy, when you have a herniated disc with a microdiscectomy, they go in and they remove the herniated portion of the disc so that it is no longer pressing on your nerve roots, excuse me. So I had horrific sciatica pain. No way you were going to get through that. Physical therapy didn't help, tried everything else. And I went in exactly 2 weeks ago and had my surgery. And you go in, you do pretty typical surgery prep stuff. You go into the room, you put on a hospital gown, and they put on these little cuffs that make your legs circulate blood, and then they go in. Now, the first time I had a surgical procedure, the anesthesia scared the dickens out of me, because I don't even like being intoxicated on liquor, I'll have a glass, maybe a glass and a half of wine, and that's all I can do. I'm a lightweight. Because I don't like the feeling of the cloudy headedness that comes with it. And so I was terrified of the anesthesia, because the first time they did it to me, I kind of felt it crawling. And so this was my second surgical procedure that they put me under general. And I'm so grateful to the anesthesiologist, because I told her ahead of time, look, I'm not going to handle this well. And so they didn't tell me they were doing it. So I went in. The last thing I remember is they wheeled me in there, and I was looking up at the bed. And I'm going to tell you about the surgical bed because it's kind of cool looking. It's different for this procedure than like something that you would be lying on your back for. Obviously, they do this procedure with the patient on the stomach, so you'd be lying face down. So I don't know how they got me up there. I don't want to know how they got me up there, but I was on this table face down while they were doing the procedure. And it's this big thing. It was really tall. It was I don't know if they had it up on a dais or something like that, but it looked very tall to me because it was up above me when I was on my regular gurney that they rolled me in on. And there's a lot of that, it looks like acoustical sponge, with the little peaks in it. Looks like one of those old 1980s, 1990s foam sponge mattresses with the little peaks in it. And there's lots of different wedges and things on there, I'm assuming, so that they can position the patient's body exactly where they want it so that they can maximize the disc space that's available to the surgeon. Let's see what else. And then when I woke up, I was not in pain. I remember some fuzzy little details about being there. I remember my surgeon coming and talking to my husband. He was talking to me too, but I don't really remember what he said. I didn't come out of the anesthesia totally for about 2 days. I was in there for well over 2 hours, and that's not, they say that the procedure can take from 1 hour to 2 hours, and my husband said I was in there for a little over 2 hours. And the surgeon, the one thing I remember him saying is that when he got in there and started removing the herniated portion, it was, quote, huge, end quote. So I don't know if mine was difficult or if it's because I'm over 40 or what the situation was, but my recovery from this was really, really difficult. And the first 3 days were kind of scary bad. And I think the reason they were scary is because all the videos that I saw before going into the surgery, patients talking about their experience with it, they all seemed, relatively functional in that first week after their procedure, and I was not. I was not functional at all. My post-surgical pain was handled pretty well. I mean, they sent me home with a bag full of things that I could use to remediate pain. I was on muscle relaxers and prophylactic antibiotics, and then Percocet was the opioid that they gave me to use. And for the first 3 days after surgery, I was taking that every 4 hours, the maximum dose allowed for me, because it was bad. Once the anesthesia wore off, it was not good. But you anticipate that that's going to happen. I mean, it's not a long procedure or as far as surgical procedures go, it wasn't that big, but you know, they did move muscles out of the way and they scraped down nerve roots and that sort of thing. So it's not, you know, you expect that there's going to be some pain when you're recovering from it. It wasn't that so much as the fact that I couldn't move much. There was a huge gauze pad over the incision that my surgeon didn't want me to remove at all until my 2-week checkup, which I just had. And so it was probably about that thick, about 2 inches thick of gauze on my back. So and of course, you know, you're scared to lay down on it because isn't that going to hurt? And actually that wasn't really that big of a deal. But I couldn't move my hips because there's no way, even if you have really good abdominal muscles, and mine are middling at best, it's really difficult to shift your hips in one position or another, even slightly, without engaging your lower back muscles. And of course, those had just been retracted, so they were really angry. So I think the most disconcerting thing for me is that when I would fall asleep, I wouldn't move my hips or my legs at all in my sleep. I was kind of immobile that way. And so there was a lot of bruising, or it felt like bruising anyway, because, you know, I would sleep for 12 hours at a time, kind of heavily sedated, really. And so when I would wake up, I couldn't move. And so my husband would literally have to put his hands around my hips and lift and shift for me for the first couple of days. I don't have any trouble with that now. I would say that after the first week, I started to feel much, much better. I'm still using a cane. I have my cane right here. It's been my old friend for about 10 years, and I'm going to be really glad to get rid of it when this is all over with. So at the 2-week mark, I think the biggest hassle is that I couldn't take baths by myself. I had to take sponge baths, and for the first several days, you know, just to wash my hair. I mean, you can see I still can't groom myself the way that I normally would. But my husband was very, very sweet and good and helpful about that. He washed my hair for me because it's difficult to rinse your hair without bending over, and that right there, that is a motion you can't accomplish, or at least I couldn't in the first couple of days afterwards. So, you know, so I was able to do that with my husband, and he was able to wash my hair for me the first 2 times after the surgery. Now I can get in there by myself and do it. And I was just cleared yesterday to go ahead and resume showering, so I can bathe myself again. That's nice. Dressing myself was not something that I think I could have done without assistance in those first couple of days. So I'm very glad that I had a partner in all of this. People who are younger going through this might want to have a parent or a sibling or a cousin or some kind of a caretaker in the home with you for the first day or two until you can start dressing yourself and bathing yourself, that sort of thing. So, and I was disappointed because none of the other videos, I don't know if maybe I'm just like an alien from space and mine was way different. Because I watched a lot of other videos and nobody mentioned any of that. So I think that's information you need, is that, you know, you're really going to need help. It's not just that it's going to hurt. You're going to have some serious mobility issues, especially in the first week after the surgery. So if you can have somebody come and stay with you for 2 or 3 days, I think that's optimal if you don't have someone who lives in the home with you to assist. The only other things I can think of that are, you know, noteworthy is, of course, you're not going to be able to lift anything. If you drop something on the floor, it's going to stay there unless you have a grabby kind of tool to pick it up for you, or someone else picks it up for you. I'm still not capable of basic, you know, domestic chores like cooking. I can't stand in one place long enough to cook. Everything is exhausting. I think that's the biggest thing, is that you're not going to be lifting anything. You're not going to be picking anything up. You're not going to be tidying anything. You're not going to be doing any domestic household chores at the 1 week mark. And if you are, even if you feel good about doing it, because I could probably physically go down there and muscle through washing dishes, or I could muscle through cooking dinner, or I could muscle through pushing the vacuum around in my living room. But that's, you know, that's contraindicated. You don't want to do that. And so even if you feel like maybe you're in a condition to do that, I don't think, my surgeon specifically said not to, and I'm assuming that yours would say that as well. So you need to know you're going to be at limited capacity, and everything is going to wear you out. I was cleared for driving, and so I drove my daughter to school this morning, and it's one of the first times I've left the house maybe twice since I had the surgery. And so today I got to drive my daughter to school, and I was absolutely knackered by the time I got home. I mean, I was completely exhausted, like winded, like I needed to lie down, exhausted. And whereas I'm not in good shape, you know, I'm not winning any fitness awards, okay? But I'm not entirely, oh goodness, I lost the word. I'm not one of those people who's entirely a couch potato. I'm not entirely sedentary. That was the word I was looking for. I do go out and do things. I do work out. I do, you know, I've been swimming with a friend, and I ride my bicycle. And I mean, you know, I move. I'm not a sit around all day kind of person for the most part. And I'm exhausted. I am worn slap out, as we say in Arkansas. So you need to know that I think the best advice I would give you is go in expecting that you're going to be immobile and that you're going to need help. And you need to line up a family member or a really good friend or somebody who can provide care for you in the first couple of weeks, because you're going to need help. But other than that, I really think this is going to be a good thing. I have absolutely no sciatica pain at all. The pain in my back is different than it was before the surgery, so I'm assuming that that's my muscles are still angry, and there's a lot of internal stitching and that sort of thing. I think I'll come back at about a month, so in another couple of weeks, and just give you another one, and that one should be much shorter and just tell you how I'm doing, because really the part of recovery in which you have more information to give is really this first part, because that's when all of the difficulty and all of the things that are new and all of the things you really need to know about are there. I'm going to be starting physical therapy in a few weeks. My surgeon doesn't want me to start yet. Not sure why, but I trust him. He's a good guy, and he's the one who went to school for 35 years, right? So anyway, I think that's about it for now. It really does hurt. You really are going to need the pain medication, even if you hate using it. Definitely keep some things around for your colon, because opioids, if you're on, I don't know, hydrocodone, Vicodin, or if you're going to be on oxycodone, Percocet, even tramadol, any painkiller that they give you that is a narcotic of any kind is going to really cause a lot of colon and bowel trouble. You're going to have issues in that department if you're taking a lot of those pain meds, and the stool softeners are not going to cut it. So I'm just putting that warning out there for you. You need to make plans for helping take care of that. Drink lots and lots of water, even if you don't want to. I think that's it. Okay, so I'll see you in another couple of weeks. And so I'm optimistic, but it was a lot rougher than I anticipated. So anyway, I hope that helped. And I will talk to y'all later. Bye.